before we jump into that, because I want to pick your brain about those ideas and share this with our community, can you tell us a little bit about what Blackstone Valley Community Health does?
Sure. Yeah, we're a federally qualified health center. We are a safety net for the Pawtucket and Central Falls cities. We serve
Mhm.
about 21,000 patients each year, providing primary care from newborns to geriatrics. We also offer OBGYN services, as well as dental services, behavioral health, and optometry. Our mission is to be the medical provider of choice in our area,
Mhm.
and we really focus on patients who don't necessarily have the easiest time accessing healthcare. I think it's really clear that a lot of the health disparities, especially in cancer screening and cancer deaths, have to do with lack of access to high quality care. So it's our mission to make sure that Pawtucket and Central Falls have great access. And to that
That's
end,
amazing.
our cancer screening rates are really high. Our lung cancer screening rate is twice the national average.
Wow.
And colon and cervical cancer are also really good. And so we do a lot of outreach to make sure people can get the access and the education that they need.
What are some of the initiatives that you're taking over at Blackstone Valley Community Health to connect with, the locals to let them know about your services?
So we've actually started with the mayors of Central Falls and Pawtucket to let them know what our services
Hmm.
are and our interest in really being more community focused moving forward.
Hmm.
And from there made other connections. We've been working with the HES and LISC to try to get a better sense of how we can help patients with things around social determinants of health. We have
Hmm.
community health workers and outreach and enrollment coordinators who do go out into the community and serve patients there, help hook patients up with insurance. And that's really important after COVID because a lot of people did lose their insurance. And so, that's where our focus has been to start, meeting with different community organizations and some developers and things in the area to see what people are looking for and how we can meet that need. The
Hmm.
majority of our patients are at or below the federal poverty level and don't speak
Okay.
English as a native language. And so it's really important to us that we sort of actively look for what communities want as opposed to waiting for people to come to us.
As far as your main goals and what you're looking to accomplish in 2025, can you share that vision with us?
Sure. I mean, I think, as I'm sure everyone listening knows, we have a real dearth of primary care here in Rhode Island. And so our first goal was to hire up as many primary care providers as we could,
Okay.
and then start creating that access and getting patients in so they can get hooked into primary care. Because we know that
Mhm.
primary care is what prevents more serious issues down the line. And
Mhm.
honestly, it saves money for the state and for everyone so that we can reinvest that money again back into promoting health. We've recruited 19 new providers this year, which means we've nearly doubled the number of providers we have. I know, it's
Huge.
very exciting. And
Wow.
so, that goal is, I wouldn't say it's accomplished, but it's well on its way. And so my next goal is to really focus on the community. That's part of the reason I'm here. And so finding more alliances that we can make, looking at different ways that we might be able to serve. We have a pharmacy in Pawtucket. We are looking to expand that pharmacy back into Central Falls again, potentially. And like I said, just really taking the temperature of the people in Central Falls and Pawtucket and getting a sense of where we could be better partners